The Sustainable Project of the Year award winner is Hospital de la Santa Creu i Sant Pau in Barcelona.
I am Noé Garín. I am a clinical pharmacist, and I work in the Hospital de la Santa Creu Sant Pau, which is a very big and beautiful hospital in Barcelona. We know that the environment is associated with health problems. In fact, the World Health Organization estimates that about a quarter of global deaths are related to environmental factors. So we decided that we had to do something. Because I am a pharmacist, I could do something with drugs, with medicines. Specifically, inhalers are one of the therapeutic groups with the highest impact. So our project aimed to reduce the environmental impact of inhalers. In the case of the PMDIs, a specific type of inhalers, they use a substance called hydrofluoroalkanes, and this substance have a huge carbon footprint, 1,000 to 3,000 times the equivalent compared to a molecule of CO2. We found that shifting about 50% of PMDI to other more sustainable inhalers will save up about 200,000 tons of CO2 equivalents.
So when Dr. Garín presented the project to us, we saw it like a very important and relevant project. From the clinical point of view, I think we can accomplish a better control of the disease, but also at the same time prescribing more sustainable inhalers. We have collaborated with the Ministry of Health, with other scientific societies, and also with patients' associations. And we have worked together in a document. It's called the Sustainable Inhaler Prescription Document.
Our project was very comprehensive. It was divided into three main parts. The first one focused on developing a framework on sustainable prescription. Also, we created a database with all the environmental impact of inhalers. And finally, we also estimated some scenarios of potential savings of CO2. We needed to collaborate with pharmacists, also with pneumologists and specialists on environmental issues. The second part was mainly worked with hospital pharmacists, but also nurses. And the last part of the project, aiming to reduce the impact of inhalers used in the hospital, we worked with the head of sustainability in the hospital, also nurses and pharmacists.
The waste that comes from medical devices and pharma components is huge. In Hospital de Sant Pau, we've been trying to promote that professionals themselves come up with ideas that we, from the boards of directors, we will support and move forward.
The role of community pharmacists is essential. They are in frequent contact with patients. They are well respected, trusted. So it's a very easy way to involve patients in environmental issues, such in this case, trying to improve the disposal of inhalers.
As a hospital, we take care of people, and caring for people means caring for society, caring for the city, and caring for the planet. We also encourage our professionals to be active in saving energy, in recycling and reducing waste. And a step forward is to include sustainability as part of our clinical protocols and even our clinical decisions. That is very important.
We are collaborating with other institutions. We have been contacted by the Ministry of Health for developing a document for sustainable prescription. Also, we have been analyzing the results of the part of the project, focusing on educating patients and specifically the results of our interventions. And finally, we are trying to implement the program of waste management of inhalers in new areas in the hospital and other hospitals. Organizations like Healthcare Without Harm Europe are essential because they provide us education, but they also help us sharing the experiences from other hospitals, other countries. We are very happy for this award. Thank you very much. It has boosted our motivation, so we want to go on trying to help to protect the environment. And we also think that sharing this experience can help others to start other projects as well.